everyone. I'm Mark Lewis. Welcome to this special edition of Arizona Doc Talk on Star Worldwide Networks, brought to you by AZCCC, the Arizona Center for Cancer Care. Everything you need to know about pancreatic cancer. We'll be visiting with two doctors representing AZCCC today on the show, and I want to introduce you to them both right now. Dr. Albert Amini is the founder and president of Arizona Premier Surgery, a multi-specialty surgical practice established in 2015. After initially starting in Chandler, Arizona, Premier Surgery has expanded to Scottsdale and Gilbert and now covers 5 hospitals throughout the city. Arizona Premier Surgery is one of the fastest growing surgical practices in Arizona. Dr. Amini is a board-certified general surgeon with fellowship training in minimally invasive surgery for the liver, pancreas, and bile ducts. Dr. Albert Amini. Dr. Wishwdeep Dhillon. Dr. Wishwdeep Dhillon is a medical oncologist and hematologist with Arizona Center for Cancer Care. Dr. Dhillon received hematology and oncology fellowship training at Drexel University College of Medicine in Philadelphia. He is board certified in medical oncology, hematology, and internal medicine. Dr. Wishwdeep Dhillon. Well, gentlemen, welcome to the show. Pretty impressive. I feel pretty humbled to have you both on the stage today. Great credentials, and I know you're going to help enlighten our audience about pancreatic cancer. So I think we start with the first question, Dr. Dhillon, which is the obvious. What function does the pancreas serve in the human body?
Thank you for having us, Mark. The pancreas is a gland in the abdomen. It sits behind the stomach, below the liver. It's about 6 inches long, but it has some pretty important functions. Number one, it makes the enzymes that help digest the food we eat. The pancreas releases these enzymes into a channel that runs through the middle of the pancreas called pancreatic duct. And these enzymes subsequently empty into the duodenum and mix with the food and help digest the food, including its fats, carbohydrates, and proteins. Secondly, pancreas makes an important hormone called insulin, which is critical for metabolism and regulation of blood glucose. And finally, the pancreas serves as a pathway for the liver to empty bile. And bile is a way for the liver to clear the body of its toxins. Whenever there is issues with the pancreas, you can run into situations where there is biliary obstruction or jaundice, there is occurrence of diabetes, or there are issues with absorption and digestion of food.
So needless to say, it's a very important organ that probably a lot of lay people are not aware of. Dr. Amini, like when you go in for surgical procedures, describe for our audience the difference between what a normal pancreas looks like and then one that's been compromised.
Sure. Thanks again for having me. I'm happy to be here. As Dr. Dhillon said, the pancreas is in a very difficult location and it serves a lot of different functions. It actually sits closer to the spine than it does the front of the abdomen, and a lot of patients sometimes don't realize that. So it makes it very difficult to even go there and look at it. It's hard to examine it without doing some invasive procedures. When we go and operate on the pancreas is divided into 3 parts. It's got the head of the pancreas, the body of the pancreas, and the tail of the pancreas towards the back. The pancreas is usually very soft. We joke and we say that it's almost like cutting through butter. It's very, very soft pancreas, very delicate pancreas.
Supple.
Exactly. When you have tumors, cancers, pancreatitis, any issues with the pancreas firms up and becomes very hard. And that you can see in the operating room, but you can also see it on imaging, on ultrasounds, on endoscopy. And those are clues to us that something could be wrong with the pancreas.
Now, Dr. Dhillon, when you talk about cancers as they go, how does pancreatic cancer compare with, say, lung or breast cancer in terms of how it impacts the population as a whole?
So it is estimated that in the United States, about 55,000 patients with pancreatic cancer are diagnosed every year. If you put that in perspective with other cancers, for example, in the United States, 270,000 patients are diagnosed with breast cancer every year, and 230,000 patients with lung cancer are diagnosed every year. However, although it is not the most common cancer diagnosis. It is one of the most important causes of cancer-related mortality or death. So pancreatic cancer happens to be the fourth leading cause of cancer-related death in the United States, and that just lets us know about the enormity of this problem in dealing with pancreatic cancer.
And when we talk about pancreatic cancer and we talk about, the causes that really contribute to the deterioration of that organ, what are we talking about?
So some of the common causes of pancreatic cancer are smoking, alcohol, obesity or high BMI. Diabetes is believed to be a risk factor for pancreatic cancer. Exposure to chemicals like pesticides is believed to be a contributing factor. In 5 to 10% of the cases of pancreatic cancer, we feel that there is a genetic predisposition or a familial component, meaning pancreatic cancer could run in families. For example, patients who carry the BRCA gene, the BRCA2 gene, are likely to have an increased risk of developing pancreatic cancer. Patients who have Lynch syndrome, which traditionally causes increased risk of colon cancer, can have a high risk of developing pancreatic cancer. There are certain syndromes of familial pancreatic cancer and melanoma. So that's something to keep in mind in the right setting, is trying to catch those predispositions in a timely manner in patients and families.
Well, and to play off that, Dr. Amini, if you had this familial background from a genomic standpoint, you want to be very cautious, obviously, but what are some of the signs they can look for the initiation of pancreatic cancer?
Sure, great question. I do believe if you have the possibility of having genetic mutations, you should be in an early detection clinic and an early detection program. And we have one at AZCCC where we screen patients, see their risk factors, and we get them in observation and annual screenings and imaging studies. So if you have the risk of that, I think you enter that program. Assuming you don't have that risk, and then we're saying, well, what are signs to look for? I think weight loss is probably one of the most common signs. Weight loss that's not intended. You're not dieting, you're not exercising, and you just can't seem to keep on the weight, or just struggling to maintain your weight. That's one of the more common signs. Another sign is getting diabetes later on in life. You've been relatively healthy your whole life, and all of a sudden your doctors are telling you, something's just quite off. It looks like you're pre-diabetic or you're diabetic. That could also be a sign that something's going on with your pancreas. Some of the later signs, abdominal pain, especially if it's kind of in the middle of your stomach, kind of going to your back. If you fit the right category, above the age of 50 and smoker and weight loss, that can definitely be associated with pancreas tumors or abnormalities or cancers. And then one of the latest kind of signs, and one that kind of everybody talks about, is you turn yellow. We call it jaundice, and turning yellow is usually a sign of the bile duct of the pancreas having a problem in it and not allowing the bile to flow normally. So people turn yellow, their eyes turn yellow, and that is a sign of potentially pancreas cancer. It could be a sign of other benign causes like stones and bile duct issues. But it would be a worrisome sign in the right population for pancreas cancer.
Well, gentlemen, I think we've given the audience a very nice primer on pancreatic cancer, but don't go away. Stay with us here on AZCCC, and we'll have more information on everything you need to know about pancreatic cancer.